Hi, and welcome back to Step 1 Network and our ongoing series talking about blood-borne infections. Today we'll talk about hepatitis C. So remember that hepatitis means infection or inflammation of the liver. There are various things that can cause this, including a bunch of viruses. One of the more common ones is called hepatitis C. So the liver is an organ that sits here, does all kinds of super important things. It filters out your blood, getting rid of toxins and processing medications, getting rid of old blood cells, fighting off infections, helping with digestion, all kinds of stuff. Without your liver, you can't live. So hepatitis C causes damage to the liver. It's very common. There are probably about 150 million people around the world who are infected with hepatitis C. Many don't even know it. Within Canada, about 330,000 people have at some point been infected. About 250,000 have a chronic or ongoing infection. About half of them don't even know it. So hepatitis C can cause fibrosis and cirrhosis, scarring of the liver, even liver failure, and liver cancers. It is the most common cause of liver failure, liver cancers, and needing liver transplants within Canada and the United States. So what is the typical course of hep C infection? With the initial infection, some people can feel sick, many people don't at all. So about 2 out of 10 people will have that infection typically about 6 weeks after they were first infected. That can include a fever, fatigue, nausea, abdominal pain, and jaundice, turning yellow in the eyes and the skin, which can also include dark urine and pale poops. Like I said, about 2 out of 10 people feel that. The other 8 out of 10 might not feel anything at all. After that initial infection, about a quarter of people manage to fight off the virus and are no longer infected. That rate is even higher in many Anishinaabe communities. However, even if a person has fought off the virus once, they can still be reinfected. So some people fight it off, but the other 3/4 or half of people still have the virus in their system for many years, which is called chronic infection. Typically about 20 years from when someone is first infected until they really start to develop all of those serious liver complications that we talked about, although they can be more common in people who have other things damaging the liver, such as drinking alcohol, other infections or medications that affect the liver, and in men over the age of 40. So that's a bit about what hep C is. How is it spread? It's spread through blood from one person to another. So if one person has hepatitis C in their blood and a bit of their blood, even a tiny amount, gets into your bloodstream, that virus can be spread from them to you. The people at highest risk for picking up hep C include people who have shared drug use equipment, even if that was only one time many years ago. So that includes anything involved with drug use. So needles and syringes, cookers and filters, even the tourniquet to tie off the arm, as well as crack pipes or straws used for snorting drugs. That's one group. Another group is people who had blood products like blood transfusions before 1990 to 1992, when testing became universal within Canada and the US. Another high-risk group of people are people who've ever been in jail or prison and a higher risk of being exposed to blood. But there are many other people who are also might have done things that put them at risk of sharing blood between people where they might have picked up hep C. So this includes any sort of tattooing or piercing done at home or in jail or in a non-professional tattoo parlor, because the needle or even the ink that is used can spread hepatitis C through blood from one person to another. Any sort of personal equipment, things like toothbrushes, razors, even manicure pedicure equipment that is shared or borrowed. Next is needle stick injuries. So if you accidentally poke yourself on a needle that was left behind by someone else, whether that's in a home, on an airplane, or in a medical setting, you could have been exposed. And lastly is through sex. So any sort of unprotected sex where there is blood involved. So that includes things like rough sex, anal sex, sex toys that can cause small tears in the skin, sex when one partner has their period. Those all could spread hep C. That risk is even higher if one or both of the partners has sores or irritation from other types of sexually transmitted infections or has HIV. If there is no blood and no other infections, the risk of Hep C being spread through sex is otherwise fairly low. Two other special risk groups to mention. One is babies whose moms had Hep C during pregnancy. The baby has on average about a 6 in 100 chance of picking up Hep C. And the last category is travelers. So people who've traveled to other countries and been exposed to blood, or had medical procedures done in places where equipment isn't sterilized as well as it is in Canada, might have been exposed. So those are all possible ways in which you could have been exposed to Hep C. The good news is that there are some really excellent new treatments that have become available in recent years, although unfortunately there is no vaccine yet for Hep C. So if you are at all at risk, you should get yourself tested. We'll be doing another video next week, specifically talking in more detail about testing. Thanks for watching. Tune in soon for our next videos talking about hepatitis B and HIV. Bye.